Welcome to Understanding Human Anatomy and to part 2 of our discussion of the knee joint. Now, the patella sits anterior to the femur and tibia, and it sits roughly in this position. And what I'm going to do is color the patella in a different color just to make it stand out. So let's use a gray color for the patella. Now the patella is a sesamoid bone. That means that it is formed within a tendon. And the tendon in which it is formed is the tendon of the Quadriceps Femoris. And the quadriceps is a large muscle. It's actually 4 muscles that come together into a common tendon, and that tendon inserts on the tibial tuberosity. So what we will have is this tendon coming down from the quadriceps muscle, and 3 of the 4 muscles take origin from the femur. The 4th one takes origin from the os coxae. And of course we're going to have to cut the tendon because the quadriceps is actually superior to our drawing. And let me fill that in. So there's the quadriceps tendon coming down to the patella, and then the tendon continues on, and it is often referred to as the patellar ligament as it continues on down to insert on the tibial tuberosity. Here, so again, let me fill this in. And the tendon down in this region often is referred to as the patellar ligament. And we'll color this in as well. So again, we'll add some labels. We'll start up here with the quadriceps tendon. And then we have the patella. Or kneecap. And again, the patella is a sesamoid bone, and it is the largest and most consistent sesamoid bone in the human body. We have lots of sesamoid bones in our feet. They're very small and variable. We also have them in our hands, and they can appear other places as well. And then the continuation of the quadriceps tendon from the patella to the tibia, and we'll refer to this as the patellar ligament. So there. Now that is the basic structure of the knee joint. What I want to do is go to another slide and take a look at the knee joint that is sliced sagittally, so sliced right down here, so that we can see more easily the cruciate ligaments. Now, we'll start looking at this sagittal section through the intercondylar eminence and intercondylar fossa. And we draw in a little bit of femur here. And then we'll draw in the tibia, and this of course would be the intercondylar eminence of the tibia, and come down, and then we'll have the tibial tuberosity coming out here and then down. And let me finish on the other side here. And then we'll draw in the kneecap. Again, we'll color the kneecap in a slightly different color. And we'll add the quadriceps tendon. Again, it will be cut. And the patellar ligament. And we'll color that in. Now, we'll draw in the anterior cruciate ligament, which comes from the anterior surface of the tibia up posteriorly to the femur, and then keeping our color scheme the same, the posterior cruciate ligament, which originates posteriorly on the tibia and passes to the anterior portion of the femur. Now, let me put some labels on this diagram. The femur, the tibia, the tuberosity of the tibia, the patella, the quadriceps tendon, the patellar ligament. And then the two cruciate ligaments. The posterior cruciate ligament and that is in orange, and the anterior cruciate ligament, and the anterior cruciate ligament is in this kind of a bluish gray color. Now, the cruciate ligaments act to keep the femur and tibia from sliding across one another anteriorly and posteriorly. The anterior cruciate ligament prevents the tibia moving anteriorly relative to the femur, or the femur moving posteriorly relative to the tibia. The posterior cruciate ligament prevents the tibia from moving posteriorly relative to the femur, or the femur moving anteriorly relative to the tibia. They're very important for stabilizing the joint. They also allow us to lock the knee so that we can stand and lock the knee and not have to actually use any muscle to keep in an upright position, to keep the joint from moving. These are very important ligaments that sustain quite a bit of stress, particularly in athletes. And the anterior, in particular, is commonly torn. They do have procedures to repair the cruciate ligaments by putting a graft in place and then providing a functional ligament again. So we have the two cruciate ligaments that prevent motion anteriorly and posteriorly between the femur and tibia. And then we have the two collateral ligaments, the lateral collateral and the medial collateral ligaments, which prevent separation of the two bones on their lateral and medial sides, respectively. This concludes our discussion of the knee joint. Thank you for your attention.